and welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Marina Lentskevich. She is a medical student, and she co-wrote the KevinMD article, Why Flu Vaccines Are More Important Than Ever in This Pandemic. Marina, welcome to the show.
Thank you for having me, Dr. Pho. Appreciate it.
So we'll get into your article in a little bit, but first off, can you share a story and your journey to where you are today?
I believe this year was a very transformative year for a lot of us, and I'm not an exception to that rule. In spring of this year, when U.S. closed down from pandemic and Chicago especially got hit very hard, I volunteered with COVID Rapid Response Team Chicago, which is an organization that I helped founding with a bunch of medical students from all over Chicago area. So I am a second-year medical student in University of Illinois in Chicago, and I had a privilege to work with medical students from all the other schools as well. And basically what we did was to provide volunteers at sites that were lacking people. Since we as a healthcare system were underprepared for the pandemic, a lot of burden was very sudden. And I personally saw hospitals very much struggling, especially in the spring, especially the ones that are less funded. So as part of the rapid response team, we provided COVID testing, COVID symptom screening in various locations, including homeless shelters that turned out to be little epicenters of the disease as well. Helped funding for the PPE, for the hospitals, etc.
So as a second-year medical student, what are some things that you've learned over the course of the pandemic?
Ironically, we were in our pulmonary block when COVID hit, and we were lucky to have amazing pulmonologists to talk to us about the progression of the disease as they were learning about it. Mm-hmm. And we were lucky to get firsthand information as soon as it came out. Also, something that I knew that I kind of explained to the friends that are not in medical schools, that medicine is constantly evolving. Mm-hmm. Many asked me why CDC and doctors began with certain recommendations in, say, March, and then changed those recommendations later, right? A lot of people didn't understand that. And what I learned this year, that medicine evolves, and in 2020 it evolves at a speed that has never been seen before. Amount of knowledge doubles within a week. Mm-hmm. At this point, and I think that's fantastic.
All right, so let's transition into the KevinMD article that you co-wrote, Why Flu Vaccines Are More Important Than Ever in This Pandemic. Now, for those who haven't read the article, can you walk my audience through it and share the story of why you decided to co-write it?
The article is about flu vaccines and in COVID time, and basically it's trying to convince the reader to get a flu shot. There are various reasons for it, and the most important one, I think the most important one is trying to decrease the burden on the healthcare system. As I already told you, this spring the burden was so big and so sudden, the healthcare system really struggled, and some underfunded hospitals actually closed down because the elective surgeries were canceled and they couldn't make enough money. And that really influenced my interest in flu season during the pandemic. And the article talks about decreasing the amount of burden, and also about the danger of a co-infection of flu, COVID together, and potentially some bad complications from that, of course. And then we talked about that thankfully CDC provided a very large number of flu vaccines this year, a lot more than the years before, especially considering that a lot of people lost their health insurance this year due to loss of employment. And thankfully, flu shots have been provided for free for uninsured folks all over the country at a lot higher rate than usual.
Now, in my primary care clinic, I still have a substantial portion of patients who refuse to get a flu shot. Now, from your experience, with your co-authors and in your institution, and from your research, what do you think are some of the reasons why people are still hesitant to receive flu shots, especially during the pandemic?
That's a great question. I think main answer is misinformation, or lack of information. I noticed people who believe that COVID is just a flu really overlap with the people that believe they don't need a flu shot because, quote, they don't get flu anyway.
Hmm.
And unfortunately, this kind of population also tends to ignore CDC regulations on mask wearing and social distancing and avoiding travel during these times. So I think this population is especially vulnerable to co-infections and really bad complications, long-term complications that we are not even aware of yet from COVID. And the way I approached it, trying to address the misinformation is trying to question these people's beliefs. Not in an aggressive way, but I would just ask, what happens if you get the shot? Like, do you think it's going to hurt you? If not, then why are you so against it? Right? And I think that when you start asking these people to critically analyze their beliefs, some of them change their mind.
Now, we're seeing that the flu, especially in the Southern Hemisphere, has been much less than normal, partially because everyone's probably masked up. And so far, we're seeing encouraging numbers regarding the flu. Now, just from your research, do you expect a weaker than normal flu season this year just because everyone is masked up and wearing PPE?
I think it's very great that the flu season is not as bad as
Hmm.
usual. And I do think it's definitely because of the mask wearing. And it shows that masks work, that social distancing works. Unfortunately, I heard that some people think that flu season is weaker because it's being underreported.
Hmm.
I hear some people saying that the flu is high as usual. It's just being reported as COVID.
Mm.
And despite me bringing up the point that people are getting COVID tested, that flu and COVID are, despite being viral diseases, they're different diseases, they're different viruses and different viral families. I can see that people who are very far from medical field are still struggling to understand the reasoning here.
Now, from your research, what do you think are the most powerful arguments that you could share with primary care clinicians like myself and those listening to the podcast to convince people in the exam room to take the flu shots? What do you think are the arguments that would resonate the most with these patients?
I think you really have to take a personal approach at this point. Our article mentioned several different approaches, and I noticed that different approaches work with different people. One approach that you can take with parents is that if your child ends up in the hospital with flu, because children do tend to be hospitalized with flu sometimes, having a child in the hospital during COVID pandemic could be extremely stressful, and you won't be able to visit the child as often. You won't be able
Hmm.
to be there for the child. And that's one way you could take, one approach that you could take. And then another approach is to try to explain that the burden on healthcare system currently is incredibly overwhelming,
Hmm.
and the number of ICU beds available is going down again. Actually, in Illinois, we transitioned back from phase 4 to phase 3 because hospitals are getting a lot busier currently. And some people like facts, some people like numbers. So when shown that hospitals have been incredibly busy, and you should do your best try to avoid hospitalization, not even for yourself, but also for people who surround you, your family, or maybe your co-worker with a weaker immune system.
Hmm.
These people tend to listen and tend to take the flu shot. Some people simply do not know how available flu vaccines are. They are not aware that you can get a flu shot basically at any grocery store, any large grocery store at this point, and any pharmacy, and the majority of the flu shots available are for free. A lot of people don't know that because they never really did research and never looked into that. So they think it's another complicated process that they have to go to, and it's not.
We're talking to Marina Lentskevich. She is a medical student and she co-wrote the KevinMD article, Why Flu Vaccines Are More Important Than Ever in This Pandemic. Marina, you're a second year medical student and we're talking in the middle of December. Now, what are some pieces of advice that you could share with your other medical students who are also going through their medical education journey during this pandemic?
I think this year really showed that not one system is perfect.
Hmm.
There's always space for improvement. And I learned that you should never be afraid to ask. You should never be afraid to try. Sometimes it seems like a system is so monolith, so untouchable, so unchangeable that you just kind of try to roll with it. But being medical students, being highly educated individuals, we really should be the ones trying to innovate these systems and to improve our patients' health. I personally think that advocating for patients' health is a very important part of medicine.
And my final question, what's your take home message that you want to leave with the Kevin MD audience?
Critically analyzing your actions and your beliefs is what makes you a better person. And you should never be afraid to unlearn, relearn, and learn something new.
Marina, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Dr. Pho.